and people are eating their lunches, and that's why we pitched this as a a lunch, at lunchtime. I just want to take a minute to introduce myself, and then I'm going to introduce Jeff. And I wanted to thank everybody for coming. My name is Lori Kowalski-Jones, and I am the relatively new director of Nexus, and I'm trying to fill Ken's big shoes. And in fact, I have taken all of his offices. This is his campus office, and still doesn't finish yet. But in any case, I'm happy to be in this space with you. I'm professor in family consumer studies and sociologist and social demographer by training. So excited for the series that we're going to have unfold over the year with Nexus, and we'll be using this as an opportunity also to talk about some of the things that are coming up. But we are really excited to kick it off this time with Professor Jeff Rose. And I was so excited that he said yes to sharing some of his work and helping us think through some issues about how we can connect with the community and with stakeholders. Just so you know, Jeff's research uses political ecology to take a social and environmental justice approach. His research leverages qualitative and spatial methods to examine systemic inequalities expressed through class, race, political economy, and relationships to nature. And he has applied this lens, among other things, to the topic, broadly speaking, of homelessness. So with that, I'm going to kick it over to Jeff to share with us some of your work. So thank you so much.
Great, thanks for that, Lori. Is everybody seeing that screen now? Is that working? Okay, great. I guess I want to start out by, well, first of all, thanks a lot, Lori, for having me, and Daniel has worked with us as well in kind of getting this going, and I really appreciate Nexus's commitment to interdisciplinary research and thinking through some of the real concerns that face our society these days. So as Lori mentioned in the background, this presentation is largely about homelessness, and it's mostly focused on homelessness right here in the Salt Lake Valley and some of the concerns that are associated with it, some of the research needs, and some of the policy implications for those research needs. So what I'm going to do over the next little bit is I'm going to talk about homelessness quite broadly, like what is homelessness, how do we understand homelessness, how do we define homelessness, so on and so forth. And then I'm going to get into the why of homelessness. Why do we have homelessness? What are some of the structural causes that are associated with homelessness? And then I'm going to get into some of my research and some of my initial research into this, which was much more ethnographic in its orientation, and some of the contemporary research that I'm involved with various partners, both on the University of Utah campus and in the community, both people with lived experiences of homelessness and beyond. So, and then maybe I'll just say kind of an overview of whatever our time together. For those of you who are with us here or watching a recording of this later, the plan is to share some of this for about half an hour or thereabouts, and then to open it up for some discussion and some dialogue and hopefully some back and forth. So I guess as always, our lives are on Zoom, and so y'all know what to do. Put stuff in the chat. If it makes sense to answer those chat questions right now, we can do that, or we can save those towards the end, or even more preferably, ask some questions as things start to wrap up, and maybe we can have some discussion on that. Okay, so getting started with that, I want to start out with a little bit of a background of what homelessness is and why homelessness matters. So homelessness is generally thought of in a couple of different ways. So a lot of folks tend to think about it as some sort of individualized descriptor. This looks at homelessness as a series of behaviors or a series of actions that are taken by a person that describe their experiences in the world. So this is often placing the onus of homelessness as an identity on the person who is experiencing homelessness. The flip side of that coin is to think about homelessness as a socialized condition, as something that we all contribute to, and this is a necessary result of our political and economic choices that we've made. This is the logical result of a capitalist political economy that's necessarily uneven, and I'm again thinking about this as a dialogue on disparities. capitalism is disparate in its outcomes. And if we have folks at the highest end of the socioeconomic spectrum, then the flip side of that is that we also have people at the lower end of the socioeconomic spectrum. And so we can think about homelessness in these two different ways. That's more from an academic perspective. From a policy perspective, the US Department of Housing and Urban Development has some very specific definitions of what homelessness is. And I think it's worth unpacking what these definitions are, because I think it really helps us understand what it is that we're actually researching. So in the official definition, and at least in the United States, of what homelessness is, we see this bifurcation between the sheltered and the unsheltered population. And the unsheltered population is where most of my research focuses on, although I've done some work with folks who are staying in emergency shelters as well, that I'll share with us a little bit later on. But basically the unsheltered population, or the unsheltered homelessness population, is folks who are living, sleeping, eating, existing in places that are not designed, or at least not ordinarily used, as a regular sleeping accommodation. And this includes alleyways, parks, street corners, abandoned buildings, public transit stations, or campsites. And I think that really gets into some interesting conundrums for us to think about. Like, for instance, if you go camping and you stay there for less than 14 days, then you're a recreational camper. If you stay more than 14 days, then all of a sudden then you're characterized as a person who's experiencing homelessness. And so some of these things, particularly post-2008 financial crisis, and then post-pandemic, I think are really being challenged in some interesting ways. And then we also have homelessness where folks are staying in a designed shelter or designed location that is meant to house people temporarily under emergency conditions. And we have a number of those across the Salt Lake Valley. And some of our recent research is really kind of delved into that model. The other definition that HUD offers us is a definition of chronic homelessness. And chronic homelessness is particularly important for us because this is where we see some of the biggest health disparities associated with homelessness. So not necessarily somebody who's experiencing short-term, but ongoing and durable homelessness. And so this is usually homelessness that's associated with some other disabling condition, or homelessness that's over an extended period of time. And you can see there's some metrics for chronic homelessness, including multiple episodes of homelessness in the last few years. The literature is pretty darn clear on homelessness and various disparities that are associated with health. People who are experiencing homelessness have an entire host of other conditions that are correlated with negative experiences associated with homelessness. So a ton of different health disparities that are associated with it, everything from drug dependency to life expectancy to generalized pain. All of those different aspects are associated with homelessness, and nearly everybody in the health sciences research would agree that homelessness is a massively contributing condition for people's lived experiences of negative health. I think that these health disparities bring up an interesting kind of chicken or the egg. And I think one of the things that I encourage my students and for community members to think of is not that homelessness necessarily causes health disparities, but that homelessness and health disparities are intertwined. So homelessness definitely exacerbates existing poor health and health disparities, but poor health disparities also exacerbates homelessness. And so that we see that these things are these kind of these self-reinforcing downward spirals that are incredibly problematic and incredibly difficult to stop those downward trends once they start. And one of the things that we can say is that homelessness is a place where accumulated adverse social and economic conditions tend to manifest. These are really difficult lived experiences, and they're really difficult to stop once they get started. So the literature is unambiguous about where we are with homelessness. This is a difficult situation. It's a difficult economic situation, a difficult health situation, and as much as anything, and one of the places that I'll get to is it's also a difficult environmental situation as well. So I think it's worth spending a little bit of time thinking about what is the current state of homelessness in the state of Utah and the nation, and then also where is it locally right here in Salt Lake Valley. So the way that most metrics of understanding and quantifying homelessness comes through what's called a PIT count, which is a point in time count. And what this usually looks like, it certainly looks like this way in the Salt Lake Valley, but also in municipalities across the United States, is the Department of Housing and Urban Development requires that there is a point in time count, usually done in the middle of winter. Ours usually takes place the last week of January, and it takes place really late at night. And what it's trying to do is just the count is trying to take a snapshot of the total numbers of homelessness, both sheltered and unsheltered, at a given point. So ours is usually like January 26th or something like that. And what happens is people gather, usually very late at night, like we'll meet at midnight or something like that. And small teams go across the city and they try to capture and try to document and try to spatially capture where folks are sleeping at any given point. And so the idea is that if we can capture it at this one point, then we can understand trends that are going on over time. And so I think it's worth maybe taking a little bit of a look into those numbers and what those have looked like in the state of Utah and more locally here over the last few years. So this is looking at the last decade across the United States. And so you can see that the point in time counts for the entire United States shows that somewhere just under 600,000 people are experiencing homelessness as of, this was the point in time count for January of 2021. So these are the 2020 numbers. And that nearly 40% of those are experiencing unsheltered homelessness. That's a pretty striking number, and it compares quite unfavorably with other nations. And so you can see that total number of unsheltered homelessness is somewhere around 225,000 people. In the state of Utah, those numbers, you can see similar trends where we saw a dip in the kind of mid 2010s, and then we've seen some increases recently here. So we see the state of Utah tells us that we have 704 as of January 2021, 704 folks who are experiencing unsheltered homelessness, which is about 22%, 22.5% of the total homeless population, or 704 individuals. Locally in the Salt Lakes or the Salt Lake Valley continuum of care, that's how these areas are designated for measurement purposes. According to these metrics, we have somewhere around 260 folks who are experiencing unsheltered homelessness on any given night, and that represents about 13.7% of the population. I think before we transition from these slides, it's worth taking a little bit of time to just look at some of these trends that are going on here. At a national level, one of the things that we've seen over the last decade is a general, very slight trend downwards for overall numbers. And we see those same trends in Utah and the Salt Lake continuum of care. However, the unsheltered numbers tend to be on a rise, a relatively recent rise. And I think it's worth thinking about what are the causes of those rises. And we can look to everything from housing markets to job pay and some other issues like that. But we're seeing that general trend. The absolute number of people who are experiencing unsheltered homelessness on any given night in the Salt Lake Valley here, in this case, 268 people, in some ways it defies belief. So if we look at actual experiences of people who are living unsheltered on any given night, the idea that there's only 270 folks in the Salt Lake Valley is difficult to compute in any kind of meaningful way. Folks who live in or work in downtown Salt Lake City will note that the rise of encampments has been pretty steady of recent in the last 2 or 3 years, and we've seen it really exacerbated during the pandemic. We're starting to get some numbers that are associated with that, and maybe even point to some root causes behind that. And I'll share a little bit of that as we progress here. So why has homelessness been a problem in the United States? In general, the issue of homelessness really exacerbated in the 1980s. And Michael Walsh and Jennifer Deere point to a decline in personal incomes, loss of affordable housing, proportion of affordable housing in our major urban areas, substantial cuts to welfare programs, certainly in the early 80s, but then substantiating throughout the early, or at least continuing into the early 1990s, and then a growing number of personal people who are facing difficulties, individual difficulties that place them at high risk for moving into homelessness. And then I think the other body of literature that's increasing in its scope and also in its depth is this idea that we have an increasingly revanchist or vengeful state that's looking at actively punishing people who are experiencing homelessness. And so this body of literature says that basically people who are facing homelessness are moved away from areas of work, leisure, consumption, and basically common civic life through both laws and social practices so that they're contained into specific areas, specific geographic locations in our urban environments. And often they're forced into situations where their everyday existence and their daily behaviors is illegal in nature. And I think that really resonates with some of my more engaged work where we're working with people who are living in our parks, public areas, street corners, places like that, who by their nature are committing crimes just by existing. So moving into to some of the research that I've done with homelessness, one of the things that we see is that homeless folks, people who are experiencing homelessness, are often at this tension between these dichotomies, between public and private space. One of the earliest works in homeless literature talks about private lives, public spaces. And one of the things that it says is that many things that are, or many of the difficulties associated with homelessness is when our private lives are aired in public spaces. And so, things like using the bathroom, having an argument with a friend, drinking alcoholic beverages, things like that take place all the time in private spaces, all of a sudden have to take place in public spaces. And those behaviors become much more surveilled and much more scrutinized by law enforcement, by the public at large, and by society. At the same time, people who are experiencing homelessness are often at this tension between nature and society, where they're not fully incorporated into society, and yet they're not necessarily welcome in nature as well. And then in Salt Lake City in particular, we have this, in many ways, a wonderful opportunity in that we have this very intense urban environment directly adjacent to a wildland environment that's national forests and open wildland recreation and things like that. And homeless folks are often at the intersection of these three dichotomies. And so the intersection of these three dichotomies is really what situated some of my initial work into unsheltered homelessness. And so what I did was I engaged in a 16-month ethnography with a group of individuals who are living in what I'm calling public nature, all in Salt Lake City's urban wildland interface. So in my research, I refer to this place as the hillside, where a population of people living there ranged from between 6 and 24 individuals while I was there. And so ethnography, for those who are not familiar, comes from anthropology, and it's a suite of different methods that are designed to immerse oneself to varying degrees into a particular culture of interest, seeking to understand that culture from an emic perspective, from the perspective of the people who are living there. So in this 16-month ethnography, I spent a lot of time on the hillside with people who are living, working, sleeping, eating, going to daily interactions, things like that, to try and understand that. Across there, I developed a number of ethnographic themes. I'm not going to spend a whole lot of time going into those ethnographic themes today, but one of the things that I thought was really, or a couple of the aspects that I think are really interesting to pull apart, is that in so many ways, these kind of daily lived experiences are very similar to the housed population. Hopes, dreams, successes, failures, very similar to how many of us who have consistent access to housing live. And at the same time, they lived in a manner that was completely different to those of us who have stable housing. And so you can see that there are stereotypes and stigmas. And one of the quotes that really stands out about people who are facing homelessness is that they are highly functional but fragile. And I think that's a good way to think about this, particularly as we start to talk about disparities, mental health disparities, physical health disparities, that folks are surviving and they're surviving just barely. When Lori and Daniel first proposed this session, they said communities living on the edge. And to me, the people who are experiencing unsheltered homelessness are very much communities who are living on the edge, in that they are surviving, at least mostly surviving, but only just barely. And so I think one of the things that we saw, or that I found in my ethnography, was that folks were managing, but life was extremely tenuous. And so life on the hillside, in many ways, kind of confounded this notion of public and private space, in that public space was appropriated as one's own. So public space was privatized and regulated in a way that is both like entirely familiar and kind of strange. That ownership and that connection to place, that place attachment, was really challenged when a displacement event occurred. And one of the things that I've found throughout my experience working with people who are facing unsheltered homelessness is that they are always, always, always on the edge of facing displacement. And so I spoke with a couple folks who are involved in the displacing event, and they said, hey, there's this large homeless population there, but don't worry, they'll be removed next week. And I thought one of the things that they said was particularly interesting. They said, we're going to clean them out. Any stuff up there, we're going to clean up. And that notion of cleanliness was reinforced when the health department came by and said, basically, hey, this is a violation of health orders, right? We can't have people living in public space. Like, your very nature of being there is a violation of our health standards. And this was in direct contrast to my lived experience. And usually the justification of the rationale for displacement is usually around two issues, which is open feces and then secondly, hypodermic needles. Despite the fact that there was like no experiences of open feces or hypodermic needles, this was cited as a problem for folks who were living there, and ultimately they were displaced. And so some of the analysis that came from this was that this notion of there was a blending of the notion of removing non-human litter and removing human litter, and to reinforce the idea that people are in fact litter on the hillside. And so this goes back to this idea of what Neil Smith would call a first nature, or this idea of a pristine environment that had to be kept clean. And the reason that it needed to be kept clean, at least in the eyes of the health department, was for this idea that we need to have a society that's free of visible poverty. At the same time, there was pressure from an economic standpoint for growth and expansion, and that caused an additional displacement imperative for the folks who are living on the hillside. And so health becomes this rationale for displacing folks and to make their lives substantially worse and substantially harder, and to deny them access to the only homes that they know, in this case, tents and tarps and shelters and things like that. And so health then affects the hillside residents' physical wellness, as well as it was a justification for institutionally supported displacement. So this ethnographic approach, I feel like, really invested me and engaged me in that particular community and gave me some sense of the lived experiences of unsheltered homelessness. I'm now going to kind of transition and contrast that a little bit with some community engaged research. And so community engaged research is not necessarily quite as experiential as an ethnographic approach, but at the same time, it's working with participants, it's engaging with participants in a different way. And I'm going to share some of the more contemporary research that we have going on that approaches this a little bit differently and engages with community stakeholders in a different way. And so along with Sarah Canham, Shannon Jones, Adise Garcia, also some graduate students, Kyle Wren and Delaney Silman, and an undergraduate student, Morrison Donovan, we have been working with some support from the NITC, the National Institute for Transportation and Communities, to understand the processes of the decentralization of our homeless sheltering services in Salt Lake City, to see what the impacts of that are, both for people's transportation, but also for their lived experience and for their access to resources. So many of you probably know that the Road Home, the large shelter downtown, which had about 1,100 beds available, was decentralized. That process started about 5 or 6 years ago. It really finished in late 2019, and we spread out to a scattered site model where there's multiple HRCs or homeless resource centers throughout the valley. One's for men, and there's a men and women, and there's a women's shelter, and those dispersed resources. And so one of the things that we were trying to understand is how did that transition affect people's lived experiences, and particularly their spatial and transportation access to resources. And so that project is just kind of in the finishing stages, and we're finishing a final report on it right now. But one of the things that we see is that these homeless resource centers are spatially distant from desired services and desired resources. The client or the people who are living there, their satisfactions with the new homeless resource centers has actually increased. The homeless resource centers are new. They're better resourced. There are more things on site that are available for them. But client accessibility concerns with the spatial access to daily needs has actually increased. They're out of that downtown core, and they don't necessarily have access to health, or they don't have the same access to healthcare, grocery, workforce services, and a number of other daily experiences. And then there's also, we spent a lot of time interviewing and working with providers, people who are working as social services providers and transportation planners. And there are like substantial structural difficulties that are associated with providing transportation services for this population. So a couple of things that I want to point out is that this project has worked really closely with what we're calling a technical advisory committee from folks who are on the ground and dealing with this. And so I think one of the things that that Lori and Daniel and the folks at Nexus are really interested in is how do we more fully engage, not just as researchers, but as researchers who are working with community stakeholders, who are working with policymakers, who are working with community planners to do this. And one of the things that this team is working on is providing future, is working in future grants that's probably going to have something like a homeless advisory board with people who have lived experiences of homelessness. And so having them really integrated into our planning and into our outreach and connection and research efforts. A couple other projects that are going on right now that I want to make sure that we highlight. We also have some projects that are going on along the Jordan River, where a couple of wonderful graduate students, Ange DeMarco in anthropology and Rebecca Hardenbrook in mathematics, are looking at what are the reasons that people are living along the Jordan rivers. And not only what are the reasons that they're living there, but what are their needs, what are their concerns, and who are these folks? And so what this looks like is on-site interviews and a little bit of surveying as well to understand some of these backgrounds. But we see that the Jordan River, and particularly riparian corridors, provide a relative sense of security and stability. And we see that folks are living in community. They're not living by themselves. They're living with others. And so I think there's an interesting question to be interrogated here around socialization and the supports around socialization, both physical safety, but then also having daily interactions with other people is really important for these folks. We see a relatively low use of the river for functional purposes in terms of like folks are not using this for drinking or cooling in the summer or provisioning. There is a little bit of fishing associated with it, but not much. But like some of the other research that I shared today, there's a persistent concern with displacement events and really law enforcement generally. And then the last thing is we asked some questions about air quality, which I know there's a big push for air quality research in the Salt Lake Valley right now. And these folks are really, in some ways, at the leading edge of this in terms of being outside on a long-term basis and having some concerns, particularly with the inversion, but then also the late summer smoke conditions that are associated with usually fires that are blowing in from elsewhere. Those are big concerns. And again, one of the things that we've done with this research that we're really quite proud of is that we've been working with the Jordan River Commission. We've been working with some other local stakeholders and also working really closely. Rebecca and Ange in particular are doing a great job of forming relationships with those people with lived experiences of homelessness. And then the last kind of community engaged research project that I'd like to share is I'm working with a number of students from an undergraduate course on environmental justice led by Dr. Adrian Cashlin. And one of the things that we're trying to understand is we're trying to document the number and the spatial distribution of urban encampments. These are not folks who are trying to hide from authorities. These are folks who are living on, on streets and tents and things like that. And so we are, we've got 7 census tracts here, and we're documenting the block faces and the numbers and the distribution of homelessness over time. And one of the things that we're seeing with this is that urban encampments are showing wide variability in both location and duration. And we're seeing that there tends to be this clustering effect that's going on with urban encampments. And again, there's a sensitivity to displacement. This particular project is really closely associated with a new initiative that's going on here with the Environmental Justice Lab. And I think the Environmental Justice Lab, which has a handful of faculty, a number of graduate students, and also some undergraduate students associated with it, is really embodying this idea of community engaged research. And so I pulled this quote from the Environmental Justice Lab website, which really talks about what does it mean to do critical community engagement. And so I thought this wording was excellent, where we avoid the ahistorical and non-political approaches that traditionally characterize social science research and also environmental or ecological research. And so I think that this paradigm really makes a change and says, hey, we are trying to note the ways in which people's lived experiences, people's daily experiences can combine with some of the research expertise that we have to produce outcomes, if not solutions, to social and environmental problems in a really productive way. So just kind of wrapping up, I think there's a number of opportunities for collaboration here around homelessness and other issues. And I've brainstormed a handful of ways that I feel like, as a social scientist, that I would like to collaborate with other folks who are approaching this from different disciplinary perspectives here. The natural sciences, I think, have something to offer, particularly in terms of ecological impacts and things like that. I think our colleagues in the medical sciences have a lot to offer. Particularly, we've done a good job with the social determinants of health, but how can we extend beyond those and really try to start to understand some of the other correlated activities that are associated with homelessness. I think there's a lot to do with comparative policy analysis in the social sciences, and I think there's also a substantial role for the humanities and the fine arts in helping us think through and helping us situate, how we understand homelessness as a lived experience and as something that characterizes our society at large. The last couple of places that I think we probably need to do a better job of, I know that as a researcher I need to do a better job, is engaging with community stakeholders. So this looks like making outreach to folks who are at the local, state, and national agencies who are working with homelessness. There's a lot of dedicated professionals who really know what they're doing and really have some insight and some, and so it would be good to collaborate more clearly and more directly with those kinds of folks. And then what are the community agencies doing and what can we do to support their work? What are the things that researchers can provide to support that? And then lastly, I think that our research could really be enhanced if we were to engage with local policymakers, local state governments, things like that. And then also making those connections for folks, because homelessness does not exist in a bubble. Homelessness is heavily connected with a number of other social concerns, social, political, economic concerns, and making those connections to policymakers and with policymakers will really enhance our work. So as we think of homelessness and communities on the edge, the way that I tend to think about this is that our homeless communities are really folks who are facing significant marginalization. We have an overrepresentation of a number of marginalized groups within that, and our homeless population is changing rapidly. This is no longer it's not only the single white male who is kind of a vagabond and living on his own. We now have families. We now have people who are gainfully employed who are also experiencing homelessness. Folks who are living in vehicles and RVs and other kind of makeshift just ways of living. And I think the idea of that traditional homeless subject needs to be expanded. Homelessness is one of those classic wicked problems where we don't know exactly what we're dealing with. There's multiple stakeholders involved with it, and it's interconnected with other social problems. And the idea that we have a simple solution to homelessness is very unlikely to emerge. So we need, in that case, we need ongoing, evolving, interdisciplinary work from lots of different approaches. And I think that's where an organization like Nexus can really step up and connect folks, not only connect folks at the University of Utah, but also connect folks from the University of Utah with some of the community stakeholders and policymakers as well. So with that, I will take a deep breath and stop sharing for a second. And I will really invite other folks to chime in and share some thoughts or some ideas or some questions. And I'm certainly happy to respond to those, but I'm also happy for the dialogue to extend beyond me.
Well, I'm gonna jump in for a minute here. Jeff, thank you so much for really bringing this whole topic to a larger audience. I know that I learned a lot when I worked with you on the homelessness project. I had no idea about things such as shelter, unsheltered, chronic, non-chronic homelessness. So definitely appreciate you kicking off the series. So thank you very much for doing this. One thing I just kind of wanted to bring to the audience is what we really want to do here is we want to engage, just as Jeff was wrapping up, we want to engage the community as well. One of the, at least personally, one of the things that I find most rewarding is working with stakeholders, legislators, and also the community organizations that will carry out the research that we're doing and actually apply it. One of the best lessons I learned from my PhD mentor, Dr. Kevin Gurney, is if you can make your research somehow become tangible policy, you're never going to get discouraged. I think that being able to see your work in action is always going to be really rewarding, and that's why for the rest of the series we will be engaging with community stakeholders. We'll be working with we will be inviting community groups, community organizations, so that way we actually see the whole cycle from identifying the problem, which the communities, the boots on the ground know what the problem is, and the legislators or the executive branch, they know what they can do, and it's up to us to provide solutions tailored to those problems, not research in a vacuum, and then translate that back into the community. So I think that that's the thrust. Homelessness to me is a fairly personal issue. I'm from Lima, Peru. I think a lot of you know that. And there are so many shanty towns surrounding the main city. So Lima officially, I think, has a population of maybe 7 or 8 million, but there are 3 or 4 million people who are living in shanty towns outside. And one thing that Jeff brought up that really struck me was that we always think of, or many of us probably think that homeless populations don't really care much about their health, as he brought up the fact that, it's called a cleanup process. But one of the things that always struck me when I would go to do community service from my high school, we had to do, I think it's about 80 hours a year of community service. When we went to these communities, we saw an organized structure, different from ours, different from a sheltered perspective, let's say, of us who do not experience homelessness. But one of the things that struck me was how clean they wanted to stay. And they boiled their water, for example. They did a lot of things that, for example, I just drink tap water, a lot of people did. But one of our teachers there said, why they're taking so much care of themselves is because they can't afford to get sick. If they get sick, that's going to be a huge problem, because they will, unlike here, hospitals will actually turn you away back home in Peru, and they will just say, well, sorry, if you can't pay your bills. Sometimes they even charge you up front to even get in the door. So those community members knew that they could not afford to get sick, because that could mean a death sentence. And I think that that's something that we need to understand. Just like Jeff said, what's interesting is, imagine every single, for example, argument you've had with your friends, partners, etc., your family members, being out in the public. And the reality is it wouldn't look that much different from when we see homeless populations outside arguing or having issues. Think about everything that we do in private and imagine that all gets exposed out into the open. So that's something that we really need to consider when we're thinking about these problems. And then compound that with some of the other topics we'll touch on later that I'll be discussing at the end of the hour, our upcoming series. So that's something I really want to encourage everyone to think about.
Thanks, Daniel. That was helpful. I appreciate that. I'll just maybe touch on a couple of these comments that I was seeing in the chat. And the chronic homelessness is as a criteria for access to the VA resources. One of the things that we see is, for many folks, and I've worked with some of the folks at the University of Utah hospitals. One of the things, and this kind of goes off of what Daniel was just saying, they are interested in working with homeless populations, and yet for all kinds of bureaucratic reasons, they're actually difficult to work with. It's difficult to have them in. There's been some kind of local efforts with like outreach buses and mobile clinics and things like that. I think one of the things that Dr. Sarah Canham and I have found in our research is that some of the homeless resource centers are providing healthcare, or at least kind of low-level healthcare in the actual clinics. But it's still difficult for folks to get to larger medical centers for those kind of like larger needs, and particularly during COVID, I think this has only been exacerbated. And there's actually there's a woman in mathematics, and she's looking at modeling the COVID spread within both encampments and within shelters. And these kinds of congregate living situations are really difficult during the time. COVID is an obvious example, but also just during winters when we have flu that spreads through the valley. For many of us, getting the flu means taking a couple days off of work and taking some ibuprofen or something like that. For folks who are living, again, to use a metaphor, on the edge, this can be a disastrous event. And so these kinds of airborne or otherwise spread viruses and sicknesses can be really, really difficult for these populations.
So one thing that, as we were talking, Rebecca, one of the things you linked this to was kind of this medical space, right? And you had in kind of going beyond the social determinants of health. And the thing that struck me was, we have mobile units, and I don't know, like on the one hand, the things that maybe people want to fund, are they the things that people need? I started thinking about a medical home, community, continuity of care, and how, some of the policy ideas have had the unintended consequences of quick hit and go. And it sounds like you've seen some of that probably in your research.
I've shared my research with students in the city and metropolitan planning, and one of the things that I tend to get from those experiences is students say, we need to design tiny homes. Tiny homes are solutions. We can do this, and they tell me. And I think one of the things that I struggle with in those responses is that people who are experiencing homelessness know what they need and what they want, and it's not tiny homes. Tiny homes are, I do think they're a Band-Aid, but they're probably a Band-Aid on like an arterial bleed. And so I'm not convinced that researchers or folks are going to swoop in from up high and we're going to out design ourselves or out innovate our way through these conditions that are a result of systemic inequalities. We have to address the inequality if we really want to see reductions in homelessness. Rebecca, you waved a hand.
I did. Thank you so much, Jeff, for this excellent presentation. And I'm really looking forward to seeing more of the research. I work at the VA. I'm the Associate Chief of Mental Health for our community programs, and one of our largest is the homeless program there. So we have about 52 staff that are out there going to homes and veterans who are housed on vouchers, partnering with county agencies. We have a HPAC, a homeless patient aligned care team that's been going out to the camps, up to the mountains, wherever as far as they're able to provide vaccinations, to provide whatever healthcare. And we're getting ready to expand that to another team because of the need is out there. So, but what I was saying in the notes about this, there's definitely a change on federal policy level in terms of funding for things that are more for us to be able to actually utilize the resources, such as not having these restrictions for chronic homelessness that have ended up in not getting people housed or not getting folks the supports that they need. They're taking away that require a lot of our services. They're also increasing SSVF, which is funding for people to be able to get into or keep a home for veterans and their families in the community. So it's a small subset of our homeless population, but I see just a change on the federal level of really looking at the research and really looking at what the express needs are from veterans. And I hope that will be a further pattern in the community where we can, incorporate the community enhanced research that you're talking about. It's critical if we want to be. We don't want to just throw resources and answers to problems to folks who know what the actual answers are, at least need to be a part of that process. So that is another exciting piece. I've been doing some work in autism research with community engaged research in the FCS program. So I really was excited to hear that is a development here as well, working with the homeless population.
That's great. Thanks for that. And one of the things that came up or that popped in my mind while you were saying that is, and Rebecca, you probably know this better than I do, but there is, nobody knows what's going to be in this new budget bill that's being proposed at the federal level, but different iterations of this have proposed significant funding for social services dealing with homelessness, everything from HUD to the VA system to like individual communities that are going to really dedicate those funds towards clinics and other services. So I guess we'll see how the politics of that play out in the next little bit here.
Hey, Jeff, question. Great job on the presentation. It was really interesting. I'm curious to hear your thoughts about individuals who are experiencing homelessness in these public spaces that would otherwise be used for like recreation. It seems like it's somewhat of a, I don't know, just sets itself up for conflict in that, like, I think of the Jordan River, like whenever I talk to people about it, they always bring up homelessness and that this discourages use. And so we have kind of competing interests, and how do we consider the interests of the broader public versus the individuals who are experiencing homelessness? And so I guess I'm most interested in hearing your thoughts on kind of what's driving people to these areas in particular. I think you highlighted some ideas, but then also, what is kind of what are the main solutions in terms of if they're not interested in housing and then, they prefer these kinds of spaces, kind of what's the solution here?
Thanks for that question. That's a good one. I did some research a couple years ago in City Creek Canyon, and I didn't share it today because we didn't talk to people who are experiencing homelessness. We talked to recreationists, and we talked to them about like what, how do they feel about homelessness? And I think and about visible homelessness in City Creek is a largely unbuilt space. In some ways, it has some similarities to the Jordan River and other kind of riparian corridors. And one of the things that we saw attitudes towards homelessness that were much more tolerant than we expected and much more accepting. And the one thing that was interesting, and I think applies really specifically to Utah, is the consensus was it's fine if they're there as long as they don't affect the water quality. Because there's the assumption that City Creek is our drinking water, which is kind of true, kind of not, because the homeless encampment is beneath the water plant, but whatever. The rationale is as long as it's not affecting the water quality negatively, then there's actually increased tolerance for homelessness more than we might have expected. I think one of the things that I tend to think about our public spaces is that our public spaces are necessarily negotiated. What a public space is and should be is largely a cultural construct. And so, I have ideas of what a outdoor recreation space is because as a white guy who participates in outdoor recreation, I have this very kind of like wilderness focused, natural, unbuilt idea. But that's not everybody's perspective on this. And so I think one of the things that I've worked a little bit with Salt Lake City Parks and Public Lands Division to talk about like, how can we provide some messaging that reminds all of us what public spaces are for. And public spaces are, I do this kind of speech with my students, but public spaces are spaces of diversity. They're spaces of encounter with the other. This is where we find people who don't look like us, who don't talk like us, who don't necessarily behave like us, and yet are fully invested citizens and community members and things like that. And so, I think one of the things that I am really hoping to do with this is to, kind of destabilize the notion that we need to get to zero homelessness. I think the majority, and I would guess something like 90-some% of people who are experiencing unsheltered homelessness very, very much want shelter. There are some, I would probably place it in the single digits, who do not want shelter, who want to be camping, who want to be outside, who want to be a bit more mobile. And I think we're going to have, I think any society is going to have, directed like the earliest written text, and there was always homelessness. And so I think we'll always have some of that. But I also want to advocate for a world where people who want to have shelter have access to shelter. And so, for instance, the Jordan River, we've got a study going on out there right now, and we ask them straight up, why are you not staying in the shelter? And the consensus, and this is near universal, is that the shelters are either unavailable because they're full or they're unsafe. And that's people's bodily material safety, or it's safety of possessions as well. So like, I'm going to have my possessions taken from me. So I think I probably like tangentially addressed a couple of the questions that were in there, but maybe none of them quite fully.
No, that was very helpful. Thank you. So your experience was that it was primarily due to housing shortages or safety. And so, yeah, that's interesting to hear. You see this increase in unsheltered homelessness from the data you showed, but there were increases in overall homelessness. And so once we moved to this decentralized model, were there fewer beds in this particular area, or?
So in the Salt Lake continuum of care, we went from 1,100 beds to, I believe, I want to say 800. I might be missing that. And those numbers are more fluid than they should be. It's really hard to actually nail that down. But there was a net decrease in beds from the moment that the road home was decentralized to what we have now.
We are off to a great. Okay, I just put the upcoming ones up in the chat, and we are almost out of time. But Daniel is part of the Nexus team, and he was gonna maybe you want to kind of close us out with what's to come.
Yes, one thing I wanted to really encourage everyone is to follow this series. As I mentioned, what we're going to do, what makes this unique, is that we will be working with stakeholders and also with community organizations. We want them to be a part of the conversation to really encourage this research to be definitely very applicable, just as Jeff has demonstrated. Our next 4 conversations will be, the first one will be in November, and thanks, Larry, for putting that up in the chat. We'll be focusing on domestic violence. That's a huge concern for communities living on the edge that really was highlighted during the COVID-19 worst part really of last year. We all saw that in the news. Then we're going to be looking at environmental exposures in January, and then the economic and policy really implications of homelessness. That will be in February, and then we'll be rounding out the discussion with mental health in March.
So come on back. So everyone, thank you so much for joining us as we kind of engage this idea of resilient environments. I'm stoked to be on the journey with you all and looking forward to seeing you in November. And thank you so much, Jeff, for taking the time and sharing your expertise with us. Happy Friday, everybody.
Thanks, y'all.